All right, so the next disorder we'll talk about is SCIDS. This is severe combined immune deficiency syndrome. This is a hereditary defect, and it's an absence of cell-mediated and humoral immunity. So the immune system basically does not function. The child will have chronic infections. They won't recover well from those infections. They'll have frequent reinfections, and they'll have infections with unusual organisms, because organisms that our immune system typically can handle really well, they don't have the ability to do that. And they will also have failure to thrive because of all the energy lost to fighting those infections. So this diagnosis might be considered if a child has a history of recurrent severe infections. There may be a family history on, when they do lab, they might have lymphopenia. They have few lymphocytes, and they don't have a lymphocyte response to antigens. If they do a bone marrow aspiration, they won't find plasma cells in the bone marrow. Ig deficiency is not diagnostic in infancy. So if they're looking for immune globulin in infancy, there's a delay in production, but also their maternal antibodies, and so they can't use that to diagnose this in infancy. Management is a stem cell transplant. This child needs a stem cell transplant. They can receive IVIG and prophylactic antibiotics for pneumocystis carinii, pneumonia, until they get a sterile transplant. And these are the kids that need to be maintained in as sterile as an environment as possible until stem cell transplant. The family also needs genetic counseling, lots and lots and lots of emotional support. Being maintained in a sterile environment actually is going to have major impact on development. This child will have a shortened lifespan without that stem cell transplant. So this is we're trying to keep them alive until they can get a stem cell transplant. Okay, we'll talk about Wiskott-Aldrich syndrome in the next segment.